Hi, and welcome to my MASA webinar. My name is Catherine Gobley, and before we get started, I just want to ask a few things. I want to make sure that if you printed the client packet you were sent, along with the link to the webinar, that you have it handy to follow along with during the presentation. It looks like this, and on the back of it, there is a notes section that you can use to jot down any questions that arise during the presentation that you'd like me to address during the follow-up call. And if you don't have the packet, that's okay. It's not a requirement, but it's just handy to have to follow along with. If not, just use a pen and a paper. And then after the webinar, I'm asking that anybody who has watched the webinar completely, please give me a call at 321-443-6839 or go to noambulancebills.com and set up a time for me to call you back. And during that call, I will answer any questions that you have about MASA. I'll sign you up if you decide to purchase a plan at any level, and I'll grab your name and address to send you a $25 gift card. Because since we can't invite people into restaurants like we normally do for lunch and learns, MASA has decided this is such a vital topic to discuss. We want to have as many people hear the presentation as possible. Anybody who listens, MASA will send a $25 gift card to. And if you've seen that presentation in a restaurant before and you're just interested in signing up and you just wanted a quick refresher as to what the benefits actually are, I put that section right at the beginning of the presentation so that when you get to the end of that, if you just want to stop listening to the webinar and call me at 321-443-6839, you can do that at any time as long as it's Monday through Friday from 9 a.m. to 9 p.m. Saturday and Sunday from 10 a.m. to 10 a.m. to 9 p.m. And now that I've kind of gotten that out of the way, I've done my little house cleaning. I'm going to go on with the webinar. Okay, so in case you're just joining me, my name is Catherine Gobley, and I am sales manager for MASA for the state of Florida. And for the last 14 years, I've been a professional senior advocate, and my specialty is medical billing mediation. I am a VA benefits specialist, trained through the American Legion and the VFW. And because MASA is held under the insurance umbrella by the state of Florida, I'm also a licensed insurance agent for the state of Florida. So MASA stands for Medical Air Services Association, Medical Transport Solutions, and our slogan is any ground, any air, anywhere. And what we mean by that is we don't care what medical transportation company performs your emergency medical transportation. We don't care if you've taken a ground ambulance or a helicopter ambulance or a fixed-wing aircraft trip to the emergency room of your choice. It doesn't matter if you are at home where you are 365 days a year, or if you've traveled away from home and you're even in another country. Any ground, any air, anywhere means just that. We're there to serve you. So what does MASA actually do? Well, in case of an emergency, call 911. Do not hesitate. Statistics don't lie. Medical transportation has life-saving technology and equipment that could save your life, and it's a proven fact that calling 911 can mean quicker care. All emergency transportation services are covered by MASA. MASA doesn't own any ground or air ambulances, but we protect you beyond your health insurance, covering life-saving emergency transportation services 100% of the time, both at home and away from home. And MASA covers all bills, both in and out of network, even if your insurance denies the claim as not medically necessary. So some of the MASA membership benefits on this slide, these are all of the MASA membership benefits that are included in every level of MASA membership. I'm going to start with the top. Emergency transportation, both ground and air. Now that's pretty self-explanatory. It means anytime that you think you're having a medical emergency and you call 911 and you get a bill, you should send that bill in to MASA. Non-emergency transportation means return flight home, visitor transport to hospital bedside, escort transportation, and minor children grandchild return. Now I'm going to go over those a little bit more in depth. So first off, I want to say that anywhere you happen to be, if you end up as an inpatient in a hospital and you don't want to be treated by a strange physician in a strange city or a strange country, as long as you have a doctor back here in the United States who is willing to receive you when we get you back and you're stable enough to fly home, MASA will get you back. But in the case where you're not stable to fly immediately, then MASA will send anybody of your choice, whether they're related to you or not, to your bedside to be an additional bedside advocate for you, so that even if you're traveling with somebody, they can go back to wherever you guys were staying and get a good night's rest instead of trying to stay awake 24/7 or sleep in a chair in your hospital room. That way, if the nurse doesn't call when you push the call button, if the nurse doesn't come when you push the call button, or perhaps the doctor comes in at 5 a.m. to do rounds and you're groggy or on medication and you don't understand what it is they're trying to tell you about your care, you'll have that other person there for you when you need them. Escort transportation means that if you were taking care of somebody who was elderly or had dementia or was disabled when you had your medical emergency, and due to that medical emergency, you can't take care of that person traveling with you, then MASA will either send them home with an escort, or if they're afraid to go home with a stranger, we will send a plane ticket to somebody they know, and then we'll get them all home so that the person you were taking care of goes home with somebody they trust. We do the same in the situation of minor children and grandchildren as well. Next one is vehicle return. It doesn't matter if you're driving a car, a boat, a motorcycle, or an RV. If you have a medical emergency when you're away from home and you can't drive your vehicle home, even if you have other people traveling with you that are capable of getting the vehicle home, MASA will transport your vehicle home. A good example of this is I was in an in-person live seminar not long ago, and a gentleman spoke up and said, hey, me and my wife are RVers, but she knows how to drive the RV. Why would I ever want MASA to drive my RV home when my wife can do it? Well, his wife piped right up at that moment and said, hey, if you're injured or sick and MASA has to transport you home to our physician, I certainly would rather be in the medical transport with you instead of having to be stuck trying to be worried while I'm driving the motorhome back across the country. I would appreciate it that MASA would get our RV home, and I can worry about being at your bedside and being involved in your care. So that's a very good example of why somebody might use vehicle return. Pet return means that if you're away from home and you're traveling with a pet and you cannot take care of your pet due to a medical emergency, then MASA will get your pet home to somebody who can take care of it as well. Now that means if your pet happens to be a horse or a lizard even, MASA will get your pet home. We don't judge, guys. Organ transportation and organ recipient transportation are another two of the great benefits that MASA offers, but they are also the only benefits that MASA offers that you're required to be a member for 1 year to take advantage of. The reason is this: the Red Cross no longer moves anything other than tissue and bone marrow. So if you're on the transplant list and you need to receive an organ and that's going to come to you from more than 2 hours away, you most likely already have a GoFundMe account to help pay for the cost of that organ being transported to you, because oftentimes our insurances won't cover that. If you've been a MASA member for a year or more, MASA will cover the cost of getting that organ to you or getting you to where the organ is so you can have that life-saving transportation, organ transplant surgery. The next one down on the list is repatriation. Now, repatriation means anytime you're outside of the continental United States and you need to be brought back into the country so you can be cared for by the physician of your choice, even if that means we fly you back on a small plane with a doctor and a nurse taking care of you the whole way, MASA will do that for you. It doesn't matter the level of membership that you have. And finally on this slide is mortal remains transport. This is kind of also self-explanatory, but MASA transports your body airport to airport. So if you're away from home, like you snowbird to Florida, for instance, and you're going to be buried up in Ohio or Michigan or Wyoming, then MASA will fly your body airport to airport to get you home for burial. Now, if you're outside of the continental United States and you pass away, it takes normally about 3 months to get somebody's deceased remains back to the country by normal means. That's because drug dealers have gotten into the habit of using a body cavity to hide drugs to sneak them back into the country, and therefore customs has to check body cavities before they can come back. MASA actually has a very good reputation for getting people's mortal remains back as quickly as possible, oftentimes in 8 days or less. Now, this slide shows all of the additional membership benefits that people get when they select lifetime MASA membership. My favorite of these is the My ID Hive medical ID bracelet kit and the lifetime membership that goes along with it. So in this kit, there is a bracelet, there is a key tag, there is a sleeve that would go over an existing watch band, there's a wallet card, and it also works as an app on your phone. And why this is such an important system is that the devices that are within the system contain a QR code, and that QR code contains the information of who your doctors are, what health conditions you have, what medications do you take, what supplements are you on. Now, you may be thinking, who cares what supplements I'm on? Why is that important? Well, the reason that's important is because if you're taking fish oil, garlic, or turmeric, for instance, those act as blood thinners naturally. So if you were in the process of having a stroke and paramedics were determining whether or not they were going to give you clot-busting medications to save your life, it's helpful for them to know what supplements you're on, because if it's a blood thinner type supplement, then they may decide to give you less of a clot-busting medication so that you have less of a chance of having major internal hemorrhaging in the process of trying to save your life. It also contains what your blood type is, what surgeries you have, what your family history is, what allergies you may have, and your emergency contacts. So this I consider to be one of the most valuable additional benefits that come along with lifetime MASA membership. Attorney advisory service is another additional lifetime membership benefit, and emergency cash advance. Now, when would you use that, you might be wondering? Well, if you happen to be outside of the continental United States and you find that you end up in an emergency or inpatient in a hospital that does not take your insurance, then most people are not aware of this, but many countries, including Mexico and Portugal, will not allow you to come back home if you owe a hospital bill for treatment. So we had an example of a lady who was in a MASA seminar in St. Cloud, and she said her and her girlfriend had gone to Portugal, and the girlfriend had fallen and broken her hip, and she desperately was trying to get back home for recovery and treatment. And they would not let her have her passport until they came up with $35,000 to pay off the hospital bill. Lucky for the patient, her friend had a credit card that she could charge $35,000 on to pay that bill so that they could get released to come back to the United States so she could get the treatment that she needed. Translation service is if you are somewhere that doesn't speak English and you don't understand the care that the doctors are trying to give you or the billing that they're trying to present to you, you can contact MASA and MASA will help you with that. Lastly, we offer Emergency Message Center to all of our lifetime members. Now, how would you use Emergency Message Center? Well, that's the one additional benefit that you don't have to be having a medical emergency to take advantage of. Emergency Message Center can be used even, for instance, if you're evacuating a hurricane and you've told your family, we're going to the Hyatt Regency in Orlando, for instance, and then once you start on your journey to get to that hotel, there's maybe a detour in traffic and you end up somewhere completely different. And by the time you are checked into a room and able to try to make a phone call to call your family, maybe the lines on the cell towers are busy and you can't get out. But if you can get one landline call to MASA, MASA will call everybody else that's on your contact list and let them know where you are, that you've arrived there safe, and when you might be contacting them in the future. We've also had people use this when they were at sea and their ship was going to arrive at port late or be delayed somewhere along the journey. So these are very important benefits to be able to take advantage of, and I'm really glad MASA has these additional lifetime membership benefits. They kind of make the plan a no-brainer. So moving on, this is an article that was in the Washington Post, and it was written by an expert on national health care known as Melissa Bailey on November the 20th of 2017. And the way her article starts is just like this. One patient was charged $3,660 for a 4-mile ride. A second patient was charged $8,460 to be transferred from a hospital that could not handle his case to another that could. A third found herself marooned at an out-of-network hospital where she had been taken without her consent. Now, sometimes people will say to me, hey, I've been to the hospital 5 or 6 times, and I've never called an ambulance. I've always just had someone drive me. Well, the reason that that's not a good idea, first of all, is if somebody's driving you in a private car, you might get stopped at every light along the way. And you might get stopped at an accident. None of us, or the most of us, don't have a light or a siren on top of our car to be able to go around traffic. And if you're the one driving the person who needs to go to the hospital, and that person you're transporting is someone that you like or love, and their health situation starts to drastically decline, then now you're a distracted driver, which is worse than texting and driving. Not only that, but you may have to pull your car over and call 911, which further delays their care. And also, in most emergencies, you may not be in the position or state of mind to have a say in that call being made. For instance, if you're in an automobile accident, the police are probably going to call 911. If you are in a grocery store and you slip and fall, then the manager of the grocery store is probably going to call 911. In fact, most 911 calls are made by a family member, friend, police, or a bystander. So when you get into an ambulance or someone calls 911, it's the best place you can be in a medical emergency, but it does make you vulnerable to getting a bill or a balance bill after you've taken that life-saving ride. This is one example of one of the people that was in Melissa Bailey's article. His name is Devin Hall, and he's a 67-year-old retired postal inspector with stage 3 prostate cancer. Now, on December the 27th of 2016, Hall went to a local hospital for rectal bleeding. The hospital did not have the right specialist to treat him for that, so it arranged for an ambulance ride to a hospital 20 miles away. Even though the hospital was in his insurance network, unfortunately, the ambulance was not. So he was stunned to get a bill of $8,460 for that trip. His federal health insurance plan paid $1,350.30 and initially sent him a bill saying he would be responsible for $727.08. But according to his explanation of benefits that he later received, it stated that the reason his insurance had only paid $1,350.30 was because the ambulance services charges exceeded the plan's Medicare-based fee schedule. When I first read that sentence, I took a step back and I realized, oh my goodness, you know, even if you're on a non-Medicare retirement health plan, your health plan bases what they're going to pay for and whether or not it's medically necessary or not on what Medicare would do. Even TRICARE for Life does this. So because his insurance plans, you know, because his ambulance ride exceeded the plan's Medicare-based fee schedule, they wouldn't pay the whole amount. So they left him with a balance bill of $7,109.70 to be responsible for. Well, he did what a lot of seniors tend to do, and that's what I like to call the $5 protest. He started to send in just small amounts of money and said, you know what, if I just send in something, they can't go to a creditor. Well, that's not true anymore, and that's exactly what American Medical Response did. So He realized this might affect his credit and decided to go ahead and do the formal appeal process. Well, he went through the whole formal appeal process, and it ended up being proven by American Medical Response that their charges were warranted because it was considered to be a critical care transport because it was a paramedic that was on that medical transport instead of an EMT. So in the end, he was responsible to pay the remaining balance of $7,109.70. That's very unfortunate. So the reality check that I got from reading this article was this. 40 years ago, most ambulances were free. Today, though, ambulances are increasingly run by private companies and venture capital firms. Ambulance operators charge by the mile and by the services provided during the ride, such as oxygen. If the ambulance is staffed by paramedics rather than EMTs, it will result in a higher charge, even if the patient didn't need paramedic level services. Also, ambulance companies and private insurers often can agree on a fair price for that ride. So ambulance services don't have to join any ambulance network for any insurance company in order to operate within the 911 system. They can simply operate as an out-of-network provider, which causes patients to get caught in a system in which ambulance services can legally charge thousands of dollars for a single trip, even when that trip starts at an in-network hospital. And just to give you an idea of what that number is, on average in the state of Florida, for every 10,000 people in any given area, there's only 1.4 ground ambulances that are in network with any insurance company at all. All of the rest of those trips that people take are considered out-of-network ambulance trips, even if they're medically necessary. If you're curious about your area, jot yourself a note down now and ask me during our follow-up call what the specifics are for your particular area. But this leaves the patient with out-of-network charges and balance bills that they're responsible for out of pocket. This is something that my partner Kim and I found on a Facebook post very recently from an EMS service. I'm just going to go ahead and read you what they had to say. This was on March 31st. The Eli Area Ambulance Service says, "This pandemic sheds light on how the public relies on us, yet we can't get funding to operate and ensure sustainability. Many services across the nation have closed their doors because of the lack of funding and increasing need for livable wages. The age of volunteerism is nearly extinct. We get no funding from federal or state governments. Some areas are lucky to get county subsidy or local taxes to support their operations. But Eli Area Ambulance relies on insurance payments and patients to pay their bills to operate. We currently only get $5.05 per annual population. Currently, we have 5,291 people living in our service area. That doesn't cover our nearly $750,000 annual budget. Now, if you'll look at their demographic on the left-hand side of the screen, they did a lot of research, and what they found is something that I've known for years as well, and that is that only 11 states in the U.S. deem EMS services to be essential enough to be able to get funding from federal and state governments. So if you look there, the only states that are getting funding from federal or state governments and consider EMS to be essential are the ones in green. If you're watching this in Florida or New York or any of the other, most of the United States that's in yellow in that picture, we're not one of those states that consider EMS to be essential. That was really shocking when I first learned that years ago, and I'm glad that there's an ambulance service that's also backing me up and telling this story to everybody that gets their Facebook posts. So how did this happen to everybody? Well, it started in 2010 when they passed the Affordable Care Act. This is when it happened to seniors. This problem existed for those under 65 for many years. What happened is, in 2011, Congress passed the Affordable Care Act, but they didn't have any money to operate the Affordable Care Act plans. So instead, they took $716 billion from the Medicare Trust Fund to help operate the Affordable Care Act system. So in the words of the Medicare Trustees Report and the Congressional Budget Office, they state that due to the Affordable Care Act, it will be more difficult to access Medicare services. They say that the Affordable Care Act raids Medicare to pay for other new programs. They say projected Medicare savings from the Affordable Care Act don't improve the program. Instead, they pay for other new programs created under the law that aren't even for seniors. By slashing reimbursement rates instead of introducing reform, the health law jeopardizes seniors' access to providers. So in essence, they took the money for seniors to pay for the health care for everybody else in the United States, and they don't even allow most seniors to take advantage of those plans. Once you're 65, unless you're on Medicaid, you don't have any access to the Affordable Care Act plans. And if you look over to the far right, you can see the cuts that they made in Medicare due to the Affordable Care Act. Now, they didn't do this all at once. They did it one hunk at a time, if you will, between the years of 2013 and 2022. So we haven't even reached the apex of this yet. They cut hospital services benefits by $260 billion, payment rates in Medicare Advantage plans by $156 billion, DSH payments and other Medicare provisions were cut by $145 billion, home health services benefits were cut by $66 billion. This really affects me personally because my husband and I take care of our elderly neighbor who has dementia. And when our doctor wrote a prescription for him to have somebody come out to the house and shower him a few days a week, we were startled to discover that that is no longer covered under a Medicare Advantage plan unless you've had a previous hospital stay, and then only for 2 weeks after the hospital stay. So heads up to anybody who may be approaching that situation. They cut skilled nursing services by $39 billion, hospice services by $17 billion, and where medical transportation falls is the all other services category. They cut that one by $33 billion, and that's the one they cut first because they claimed that they were hoping that's the area that seniors would be using the least. But what happens to us as we age? Our health declines, right? So that's a ridiculous excuse. I say they did this very sneaky. And the reason I say they did it sneaky is because every year, seniors across the United States get a letter from Social Security stating what their cost of living increase for the year is. And then a couple weeks later, another letter comes out, and that letter tells the senior what their Part B premium cost has gone up to. So depending on where you live in the United States, you either take a wash in the increase of your income or a loss in the increase of your income, but you're not truly getting an increase of your income. So the reason I mention this is because they put a stamp on those letters and they mail them out to seniors every year. But the one thing that they chose not to mail out to seniors is a document called Medicare Coverage of Ambulance Services. And I'm going to go over that in just a couple slides with you. Before I do that, though, I want to share with you how ground and air ambulance claims are actually denied. First thing they did is they changed the definition of medical necessity that you are under now from 65 years and up to match the definition of medical necessity that everybody of every younger age has been subject to for many, many years. The medical necessity definition reads like this. Medical necessity is established when the patient's condition is such that use of any other method of transportation is contraindicated. So in any case in which some means of transportation other than an ambulance could be used without endangering the individual's health, and here's the kicker, guys, whether or not such other transportation is actually available to you, no payment may be made for ambulance services. So if you're stuck at home by yourself, you think you're having a heart attack, you call 911 because you don't want to die, and they come and take you to the hospital, and when you get there, it was just a really bad case of gas, and they can give you some medicine and resolve it and send you home. then even though you thought you were having a medical emergency, Medicare will not consider that to be a medically necessary reason to be able to take an ambulance, because you could have gone by other means and had the same outcome, in their opinion. Although there would be no way for you to know that in advance, they won't pay the bill. And also they state that Medicare may only cover ambulance services to the nearest appropriate medical facility that's able to give you the care you need. So for instance, if there are 2 hospitals in the town where you live, or 2 within 15 miles of each other of where you live, and one is one that people all call the Band-Aid station in town, you know where it is, every town has it, or you have the choice of going to the other one, and you choose to go to the other one, but it's a little bit further away, then Medicare will only pay the miles to the nearest medical facility. Who do you think it is that gets stuck with the bill for the balance of those miles? If you guessed it's you, you are correct. Okay, so this is the guide called Medicare Coverage of Ambulance Services that I was referring to. And if you did get the PDF document and print it out prior to this presentation, you're going to find the copy of the page on the right in that packet of information. And it reads like this. It tells you at the top that Medicare Part B covers ambulance services to or from a hospital, a critical access hospital, or a skilled nursing facility. It tells you that Medicare covers and helps pay for ambulance services only when other transportation could endanger your health. Then they go on to tell you that they will only cover ambulance services to the nearest appropriate medical facility, like I said on the page before. And they say these are some examples of when Medicare might cover emergency ambulance transportation. Now, I didn't put that word might in there. That's their language. And they tell you when the paramedics arrive, if you're in shock, unconscious, or bleeding heavily, or you need skilled medical treatment during transport, they might cover the transport cost. But they tell you to remember, these are only examples. Medicare coverage actually depends on the seriousness of your medical condition and whether or not, in Medicare's opinion, you could have been safely transported by other means. Now, I'd like to share with you an example of something that somebody stood up and said to me during an in-person presentation in the St. Cloud area. This was a lady who had been doing something we often do on at least a once-a-week basis. We take our trash can out to the end of our driveway and we leave it for the trash guy. Well, this particular now MASA member went out doing that one morning, but her driveway had kind of a downhill slope. So when her trash can got to the end, it sort of started to go down that slight downhill slope, and it threw her off balance. She fell backwards. The trash can came backwards. She ended up hitting the concrete in her driveway, hit her face on the cement. Her glasses went flying, and one really terrible thing happened that she didn't even realize it happened. She was pushing the trash can with the lid open because it was rather full, and she had her hand stuck in where the hinge was. So when the trash can slammed back, it shut like this, and the hinge came down, and it almost completely severed her finger. Now, at first, she didn't realize this. So she crawled into her home. She called her neighbor, who happened to be about 80 years old, no longer has a driver's license, and said, "Hey, will you please come over and help me get cleaned up? I've fallen in the driveway, my glasses went flying, and I really can't see what I'm doing." So the neighbor came over, and the minute she walked in, the first thing she did was gasp because she saw the lady's dangling finger. She said to her friend, "Why didn't you call 911? What do you expect me to do?" And she said, "What are you talking about? I just need you to hand me a rag so I can get cleaned up." Well, up until that moment, she hadn't realized that she had almost completely severed her finger on the trash can. So when she realized it, she agreed, and her friend called 911, and she took that ride to the local hospital here in town in St. Cloud. And when she got the bill, she was in the hospital only for about 10 hours. They stitched her up and sent her home. Well, when she got that bill, it was for over $800. And the stamp on the bill said, "Medicare declined payment on this bill. Therefore, Her expensive Blue Cross and Blue Shield supplement also declined to pay any portion of the bill, and they left her with that total balance as her responsibility. So this was very startling. It was startling to me too, and I'd experienced this many, many times in my medical billing mediation. It's one of the main reasons I chose to become a MASA presenter, because I began seeing this happen to my clients over and over again. And once I understood it was because Medicare changed their guidelines for how they pay for these ambulance rides and why they pay for them, I began to realize we just can't win here. But what we can do is we can have peace of mind and protect ourselves proactively. If we take a ride, we can know for a MASA member we're not going to end up getting a balance bill. And they didn't send these out. What they did instead is they placed these guides first at the Department of Health and Human Services, a downloadable PDF document, and now I notice they're available at Medicare.gov. But still, they're not a printable document that they're going to mail to you. According to them, I should remember there was such a thing as a Paperwork Reduction Act, and that's why they don't mail them out, or at least that's the excuse they gave me. So my counter to that was, what about all the seniors who use their phone for the internet, who may have a computer or a laptop but not a printer? Because let's face it, ink's expensive. If you're living on a limited budget, that's something you may well have cut out. But their response was, any senior can go to any public library, use a computer, and print out this guide if they need it. I think that's pretty crummy, and I think that's pretty sneaky, because they could have chosen to mail this document out at least one time so that every senior in America would know they've made these changes. My opinion is that they didn't want people to know that they made these changes. So how much will Medicare pay? Well, most emergency medical transportation today is considered out of network. When a service is out of network, most policies will only pay based off the usual, customary, and reasonable rate. The amount paid for a medical service in a geographic area is not only based on what they do for you, but it's also based on your zip code, much like car insurance and homeowners insurance. So if you live with a rural zip code, even if you're not in a rural area, your ambulance bill will be more expensive simply because of the zip code that you chose to live in. That's something we don't think about when we choose where we're going to live, isn't it? And a balance bill is normally generated after someone uses ground or air transportation. And remember, it's the patient who gets the balance bill, not the insurance company. That's what's left after the insurance company is done paying what they're going to pay. So because of these reasons, the reality is, even if you're spending those extra bucks for an expensive Medicare supplement, that does not mean that or guarantee that they are going to pay your bill. You are still exposed. These on this page are some actual ground ambulance bills of MASA members that MASA paid. The reason I chose these bills are because the one on the top left is one where the person had a Blue Cross supplement, and the cost of their ride was $4,967.90. And since Medicare paid zero, Blue Cross also paid zero. Down below that is one for those veterans out there. This is a TRICARE for Life ambulance transport bill, balance bill. And because Medicare would have declined that as a medically necessary ride, TRICARE for Life did the same thing. Now, the ones on the right are ones where the insurance did not argue it was medically necessary, but these people were using out-of-network ambulances. So the first one, the cost of that ride was $1,718, and because it was an out-of-network ambulance provider, the insurance only paid the amount on the Medicare fee schedule, which is $374.40, which left the client with a balance bill of $1,343.60. The other one, they only went 9 miles, guys, and the total charges for that ride was $1,484.21, and the insurance paid $464.51, leaving behind a balance bill of $1,019.70. The great thing for all of these guys is they had MASA memberships. They were able to fold their bill in half and mail it into MASA, and MASA paid all 4 of these bills. But I ask you, when you have a medical emergency in your household, let's just pretend you're married and it's your spouse having the medical emergency. Are you going to be the person like myself who runs out to the end of the driveway when you know the ambulance must be close and you go, hey, this is where you need to come, so they find you quickly? Or, and I know this is ridiculous, but I'm going to say it anyway, you're certainly not going to be the person who holds their finger out and goes, stop, I want to check with my insurance company to make sure your ambulance service is in network with my insurance company before I allow you to save my spouse. Of course, nobody's going to do that. I was being facetious, but I just put that out there as an example. Do they expect us to do that? I think it should be our right to get life-saving medical emergency transportation anytime that we perceive that we're having a medical emergency. Who are they to judge us? So this is an actual testimony from an air ambulance bill that MASA paid for Cheryl Harvey, and the amount of this air ambulance bill was $68,000. Now, what happened with Cheryl is she had fallen and gotten herself to the hospital, and she had a lot of swelling in her neck. So she went to the emergency room. They took x-rays and digital images of her neck, and the doctor determined that if the swelling didn't go down, she was going to need emergency surgery, which they couldn't do at the hospital where she was. So here's what she writes. She writes, claims for both medical care and all ambulance services were submitted to my health insurance. MASA also received the ambulance claims. What the ER physician of over 20 plus years and the St. Louis ER neurosurgeon determined was a medical emergency based on the digital images of my neck and a pending need for surgery was denied multiple times by my insurance as a non-medical emergency. So let me just touch on something. Professional doctors of 20 plus years looked at her images, determined that they felt she might need emergency surgery to save her life, and the original hospital emergency room doctor knew that the hospital where she was at was not capable of that surgery. So they simply sent her to a higher level of care just on the other side of town. And because they did that, and then when they got her there, they were able to give her a cocktail of medications that probably were not available at the first hospital, but ultimately reduced the swelling and enable her not to have surgery. Medicare determined that they should have transported her by other means, and they would not pay for the cost of the air ambulance trip. But in complete contrast, she writes, the president of MASA personally called me in my home and let me know the claim had been received. I shared my concern that I might need to sell my house, but he put my mind at ease. He explained that my kind of situation was exactly the reason MASA existed, to provide medical transport coverage to people of any income level so that no accident resulted in financial charges beyond a patient's ability to pay. That really makes me feel good about working for MASA. And it makes me relieved that since I'm a MASA member, if that ever happens to me, I will not get another air ambulance bill in my life, because 24 years ago, I had a 4-year-old daughter that due to a defective stovetop got third-degree burns over 18% of her body and took an air ambulance ride. Unfortunately, even though my husband and I had the best Blue Cross Blue Shield insurance money could buy, our insurance company denied that claim and stuck us with the whole $33,000 bill because she wasn't burned over 20% of her body. That's ridiculous then, and it's ridiculous now. And as you can see, the cost has really skyrocketed in the last 24 years. So what do these cuts mean to medical emergency transportation? Well, the Centers for Medicare and Medicaid Services say it pays an average of $4,624 per ride, plus a $31.67 a mile fuel surcharge which works out to an average Medicare reimbursement of $6,556, a mere drop in the bucket for helicopter ambulance rides for seniors. Medicaid in most states actually pays less. So what are the facts? Well, the facts are the further you live away from a hospital that provides major trauma care, the more expensive those transportation costs will be. Today, the average cost nationally for a ground ambulance is $1,214. The average cost nationally for an air ambulance, though, is actually skyrocketed to $50,200. Now, wouldn't it be great to know that you can have total peace of mind, that your loved ones can be taken to the best trauma center that can give them the care and support needed to recover from the medical emergency without the extra stress and tension of a possible balance bill? Let me explain to you what doctors are thinking when they send you on, because believe me, they're doing it for your best good. So first of all, anywhere you might be taken is designated with a certain level of trauma from level 1 to level 5. Now I realize I only have four levels on the slide, because level 5 would be like the walk-in minute clinic at Walgreens or a CentraCare walk-in clinic. Level 4 is a simple hospital or kind of an annex really that will stabilize the patient for transport to a higher level center, and they may not have a 24-hour emergency room. Now, level 3 hospital is kind of the local hospital like every town has. In St. Cloud, it's St. Cloud Regional. Many towns have them. I think every town has one. And a level 2 medical center is very similar to a level 1, but a level 2 medical center has one marked difference. The specialist doctors, who would be trauma care physicians, don't work for the facility at a level 2. They're a subcontractor doctor, which means when they're on call, they're allowed to be up to 1 hour away from the facility. Where in stark contrast, at a level 1, the specialists do work for the facility, and when they're on call, they're allowed to be no further away than 20 minutes. Boy, does that make a big difference in the quality of your care. Also, at a level 2, they don't attract every specialist that would be possible, that would be able to treat any type of trauma situation, and they don't have all equipment on site to handle certain trauma conditions. Whereas at a level 1, not only do they have every specialist that you might need, they also have all the equipment and supplies to be able to treat you from prevention through rehabilitation of anything that can possibly be wrong with you. So their official definition is a level 1 trauma center is considered to be a comprehensive regional resource that is a tertiary care facility central to the trauma system. That's definitely where I would want myself or any loved one to be taken immediately if they were having a major health condition or traumatic injury, because I want my loved ones and myself to have the best possible care and the best chance of a positive recovery. Don't you? So then what is the triage criteria for transporting patients to a trauma center? Well, since my main audience that I do presentations for is 55 and older, I'm going to give you the criteria, the triage criteria for transporting patients who are under the age of 5 or over the age of 55 to a trauma center. If your age is different than this, I can discuss your particular criteria with you during our follow-up call. So the first thing they do is they determine if you might be in your golden hour. The golden hour is defined as the hour immediately following traumatic injury in which medical treatment to prevent irreversible internal damage and optimize your chances of survival are the most effective. So if you're in your golden hour and your systolic blood pressure is less than 90, your respiratory rate is less than 10 or greater than 29, you have a certain type of pelvic fracture. You fracture 2 or more long bones at the same time. You have an open or depressed skull fracture as part of what's going on. paralysis is involved. You have a cardiac or respiratory disease history. You are an insulin-dependent diabetic. You have cirrhosis of the liver or are morbidly obese. You're over 55 and pregnant. You've probably got some additional issues just beyond whatever your medical emergency currently is, but that's on the list. It does happen. If you're in an immunocompromised state, or you are a patient taking anticoagulants or with a bleeding disorder, they are more likely to send you to a level 1 trauma center because doctors are graded based on the outcomes of their patients. 50 years ago, think about it. If you went to a primary care doctor then, they pretty much treated you for whatever was wrong. But today, when you go into your primary care, if there's certain things wrong with you, what do? They often send you to a specialist. That's not because particular they want to do that. That's because, number one, insurance only allows them to do certain things in the office, and likely, on the same lines, insurance only allows hospitals to treat certain conditions depending on what their designated level of trauma is. And so that's why they make the decisions that they make. I did a MASA plan with a doctor that lives in the Spring Hill area just last week. And she said, yes, we want to be sent to the level of care that's the best for us. And that's why we do that with our patients. We want our patients to get the best possible outcome. And so that's why they do this. So I hope that clarifies a little bit of things for you. But if it doesn't, I can answer any follow-up questions with you on the follow-up call. So this is a reality. Medical expenses are the #1 cause for depletion of IRAs and retirement funds in the United States today. If you'll notice, older Americans are more likely to tap retirement savings for medical expenses. Between the ages of 45 and 54, the risk for that is 15.54%. Between the ages of 55 and 64, it is a 23.6% chance. 65 and up, that's a 25.60% chance that if you have a major medical emergency, you're going to have to type into your retirement savings to cover your medical expenses. And if you're not a senior that has savings, then bankruptcies resulting from unpaid medical bills will affect nearly 2 million people this year, making healthcare the #1 cause of such filings and outpacing bankruptcies due to credit card bills and unpaid mortgages. This is startling statistics, guys, but I know it happens. That's why I work for MASA, because this was the best way that I could protect my senior advocacy clients from getting these bills. So what's the solution? MASA Medical Transport Solutions. Why? Because MASA is a division of Medical Air Services, also known as MASA Global. We first started in 1974, and we've been serving families like yours consistently for 46 years. MASA is dedicated to its 1.9 million active members in the United States alone. We have a superior reputation and track record with the Better Business Bureau. In fact, we have an A+ rating. Even hospitals, personnel, EMT, and other medical professionals are loyal MASA members and promote MASA to their own patients, friends, and family members. And MASA is trusted and partnered with major groups and organizations, including the Air Force Association, the National College of Surgeons, many teachers' unions, Neptune Society and National Cremation Societies, and all Dignity and SCI funeral homes across the United States. Will you ever need MASA? Well, there's nearly 1 EMS call for every 10 people any given year nationally. What happens to your health the older that you get? Well, you're more likely to need an EMS transport, of course. Where do 90% of all medical emergencies occur? Well, within 5 miles of home. I know I heard that from my parents, and I bet you heard that from yours as well. Why? Because when you're close to where you live, you're less likely, as well as everybody else that lives in the area, to pay attention closely when you're at home. You might accidentally skip that stop sign by your house if you're used to nobody being at it. You might unconsciously do it. I remember my dad chastising me for making what he called California stops. I don't know why they call them that, but that's just what my dad called them. And there are over 550,000 air ambulance transports each year, with 54% of those being inter-facility transfers. So what we guarantee as a condition of membership is we are never going to ask you a health question. We have no age limits, except that you have to be at least 50 for a lifetime, but you can buy any other level of membership at any age. We have no claim forms. We just ask that the bills be submitted to us within 180 days of receiving them. That's 6 months. That's a long time. We have no deductibles. In fact, if your insurance says we'll cover that medically necessary trip, but you must first meet your deductible, and then we'll pay up to a certain percentage, then MASA will pay your deductible so that your insurance pays their portion, and then we'll come in and we'll pay what's left at the end after your insurance has paid their percentage. We have no network limitations. We have no dollar limits on emergency transport costs, and we offer worldwide coverage. And one of my favorite things about MASA's guarantee is even pre-existing medical conditions are covered from day one for emergency transportation services. So if you have a pre-existing medical condition the day, that exists before you sign up for MASA, and the same day that you sign up for MASA, you take an emergency medical transport due to that pre-existing condition, we are still going to cover the cost of that bill. You guys, there's nobody else in business that can offer that. We are very unique in that topic or that condition. If you do have a pre-existing condition though, for the first 90 days of membership, we are not going to do the non-emergent benefits. So we won't bring your dog home, but we will pay for your medical transport bill. After 90 days, we erase the chalkboard, if you will, and you never had, in our opinion, a pre-existing medical condition, and then all MASA membership benefits would be available to you immediately. And of course, it should go without saying, if you have a medical emergency that does not involve a pre-existing condition, then all MASA memberships benefits would be available to you immediately. So what I'm going to share with you now is a very quick video that was on ABC News called Sky Rage Bills, Debt, and the Lawsuits That Follow. Following this video, I'm going to very quickly re-review the benefits of MASA. I'm going to go over the prices with you, and then I'm going to invite you to set up your follow-up call.
Millions of Americans are rushed to the hospital every year. 400,000 of them transported by emergency helicopter. Many times it's a life or death flight where every second counts. But the service often comes with a sky-high price tag. Tonight, ABC's chief investigative correspondent, Brian Ross, examines the big business of air ambulances.
We're talking about very critically injured patients, traumas, strokes, heart attacks.
Emergency workers call it the golden hour, the crucial 60 minutes to get medical care for a patient facing death.
Failure to get them to the care probably means that they're not going to survive.
That urgent need to beat the golden hour clock has spawned a nationwide fleet of helicopter ambulances, saving countless lives. But our Nightline investigation, conducted with ABC stations across the country, also found it has left many of the very people it saved facing financial turmoil, with bills as high as $40,000 or $50,000 for a short flight.
Would you call this price gouging?
Well, some of it is. There's no question that some of it is.
Warren Larson of Owensboro, Kentucky, a helicopter pilot himself, says he was stunned at the cost of the quick flight for his daughter after she was injured in a serious off-road ATV accident. $47,000 for 79 miles. After insurance and a failed negotiation, he still owes $36,000.
It's definitely going to cripple us financially.
He is not alone. With our ABC teams across the country, we found hundreds of families.
Some worry to death about it. It's very stressful worrying about it.
Being sued.
I don't have the money to give them, so my wife and my son and myself don't want them being homeless.
Or hounded by debt collectors.
I look, I see the number, I'm like, I know who it is, I know you want to talk to them.
over huge bills their insurance won't fully cover.
I feel like I can never dig out.
Some forced into bankruptcy, one after another. Patients told us how they felt they had been taken for a ride in more ways than one.
I wasn't asked if I wanted to go on the helicopter. I didn't think I was hurt that bad.
91-year-old Warren Lowe and his wife Ethel were on their way to church in Virginia when an uninsured driver slammed into their minivan.
911, where's your emergency?
Car wreck here on 89. Several people hurt.
Lowe's leg was shattered, and doctors at his local hospital wanted him sent to a trauma center 55 miles away.
Didn't nobody tell me nothing. They just took me and put me in the helicopter and gone.
The cost, $47,000 for a 20-minute helicopter ride.
I couldn't believe it when I looked at it. $47,000. That's ridiculous.
Jean Medina got a $35,000 bill after her teenage daughter, Sophia, on a family vacation, developed complications from a tonsillectomy.
The surgery itself was a total of $16,000, and the helicopters nearly $35,000. It just seems a crazy amount of money.
After insurance and a protracted back and forth, she still owes $17,000. And Medina questions whether her daughter's 37-mile medevac trip was even necessary. It took almost an hour for the helicopter to just arrive and load, and she was able to drive the distance in almost the same amount of time.
I left a few minutes before they took off and ended up arriving at the hospital about 5 minutes after they did.
The decision to call in a helicopter ambulance is made by attending doctors. But the families, like the Larsons of Kentucky, are the ones on the hook for the cost. Warren Larson says he was being treated himself, given morphine, when he signed this consent form for his daughter's medevac trip, which in small print made him personally and fully responsible for the bill.
They said, don't worry about it. It's just a standard form. It's to give us permission to transport your daughter.
Nowhere on the standard form does it inform the patient or guardian of the expected cost. State insurance regulators say they have been unable to rein in the prices or tactics of other helicopter ambulance services because of a loophole in the federal law. Al Redler is the insurance commissioner in Maryland.
When the federal government deregulated the airlines industry, these commercial helicopter companies were part of that.
As if they're a major air carrier.
That's exactly right.
So you can't regulate them because of the FAA rule.
That's exactly right.
They can get away with these charges. They can charge, as you say, whatever they want.
They can. They can.
For Nightline, this is Brian Ross, ABC News, New York.
Okay, so that's pretty startling. I thought it was very shocking when I've seen it. When I first saw it, I mean, and I know that some of you may have already seen that ABC News video, but I just wanted to share it at the end so that those of you who haven't seen it could see it. And maybe you will share this with your children as well, because this is something that affects people of all ages, not just people 65 and older. So very quickly, the MASA membership benefits include emergency transportation, both ground and air, non-emergency transportation, vehicle return, pet return, organ transportation, organ recipient transportation, repatriation, and mortal remains transport. Now, those are all of the benefits that are available for all levels of MASA membership, just like I went over at the beginning of the presentation. And then the additional membership benefits only available to those people who choose lifetime memberships include the MyID Hive Medical ID Bracelet Kit, the Attorney Advisory Service, cash advance of up to $50,000, translation service, and emergency message center. So now, becoming a member is very easy. If you decide that you believe like I do, that this is very important to have this peace of mind and protect your finances from having these bills, then when you give me a call, I can fill out the application over the phone. You will just simply choose your membership option and you will be covered immediately, and you will have peace of mind of knowing that even if you just think you're having a medical emergency, you can take the safest possible way to the hospital, especially right now when we have the COVID emergency. An ambulance is the safest way to go. They sanitize the ambulances between every rider. And that way you don't have to worry about somebody some loved one being at risk waiting in the waiting room for you if they even let them in during this time. And you will get immediate care the minute the paramedics arrive. So the next thing I want to go over with you are the membership options that MASA has. I'm always going to start off at the bottom, but before I go into the pricing, I want to point something out. You will notice that there is a national price on the left and a current Florida price on the right. The reason for that is that, as I said earlier, the state of Florida holds MASA under the insurance umbrella. Because of that, when we decided to raise our price nationwide for the first time in 7 years, we could do that everywhere else immediately, but for Florida, we have to go through a few hoops before we can do that. So anybody who purchases from a Florida agent right now, whether they live in Florida or not, can take advantage of the current Florida prices, which are much lower. So time is of the essence. Our current Florida price for a month-to-month membership, if you're a single person, is $24.17 a month, which is less than most of us spend at the Dollar Tree, let's face it. And the current Florida price for a family membership, which includes any two people living under the same roof who are in a romantic relationship with each other, whether or not they are married, and any children they are still financially responsible for under the age of 26, that's $32.50. Moving on up, we have an annual membership. For a single annual membership, it's $290 a year, and for a family annual membership, it is $390 a year. Now, if you want to save a little bit of money, the Platinum 5-year membership is a really great value. It saves you a couple $100 on the price, and guess what? You've locked in that price for 5 years. So price increases won't affect you for 5 years. The current Florida price for a 5-year membership is $1,305 for a single, and for a 5-year family membership, that's $1,755. And there are affordable payment plans available for 5-year and lifetime memberships, and I can go over those with you on our follow-up call. And lastly, the plan that almost everybody eventually ends up on if they don't choose it immediately, which most people do, as long as they're 50 years or older, is our Charter Lifetime Membership. That membership is the best value because, first of all, how many times do you pay for a lifetime membership? Once, right? So not only have you locked in the price for your lifetime, you have unlimited use. There are no caps as to how much money you can spend. We don't have any provider limits. So guess what? You pay one time and you're covered for life. That's amazing. There's nobody else in the industry doing this. So a single lifetime membership is $2,900, and a family lifetime membership is $3,900. So if you decide to become a member today, or you set up a follow-up call to become a member when it's convenient for you in the future, I will take all of your information, sign you up as a member, and then what I'll mail you is a packet that looks like this. And inside is a page that tells you how and when to use your MASA membership. And guess what? You'll have your temporary ID cards, my business card, so you'll know how to contact me in the future, a little decal that you can put on a window or a door, maybe a car door or an RV door or just your window of your home. And then all MASA memberships come with a 30-day money-back guarantee. That means you have a 30-day free look period that if you get all of your paperwork and you decide this just wasn't for you, then all you need to do is send in a cancellation form and MASA will refund the entire amount that you paid for your membership. Also, if you start off on a lower membership and then decide you would like to upgrade in the future when you're on more stable financial footing and go ahead and go for that lifetime, then any unused portion of the plan you're on from an annual on up can be credited toward the purchase of a lifetime membership. So now that you've listened to the MASA online webinar, I hope you've decided that this is something that will give you peace of mind. Either way, please give me a call at 321-443-6839, and we can do your follow-up call immediately, or you can schedule a follow-up call at www.noambulancebills.com, and I can get the information to send you your $25 gift card. Thanks so much for listening, and please send this webinar presentation to somebody else you think might benefit from the information. And for those of you who become members, my senior advocacy services are free to my members. So I hope that I get to talk to you soon, and have a great day.